Good morning to both of you, gentlemen. So according to the CDC, the United States now has nearly 17 million cancer survivors, and by 2030, there will be about 22 million survivors. Staying healthy after cancer treatment can be challenging, and many survivors do not have the right access to proper care. The CDC's new mission is to help cancer survivors adopt healthier behaviors. This morning for World Cancer Day, today, Director Lisa Richardson and two-time thyroid cancer survivor Rebecca SHIMKETS are live from Atlanta to discuss a virtual simulation tool survivors can use called Talk to Someone. And we should note that this interview is sponsored by the CDC. Good morning to both of you.
Good morning.
Good morning. Let's start. What is Talk to Someone?
So Talk to Someone is a virtual human tool that we created, and her name is Linda. And Linda is a cancer survivor. And what she does is she interacts with whoever goes on, cancer survivors, and talks with them about healthy behaviors and lifestyle change, including smoking, tobacco, physical activity and nutrition, as well as some of the things that we don't talk about very often, anxiety and depression. And so it's a tool that is used on the web anytime that a patient feels like they need to go on, a survivor, and just find out information about how to live healthier.
And Rebecca, as a survivor, have you used this new tool, and how has it helped you?
Talk to Someone was not available when I had cancer and in the early stages of my survivorship, but I have gone online and experienced several conversations with Linda. And I have to say, Linda is a powerful tool. She's empathetic. You can ask Linda questions. Linda responds to you. And what's really great about the tool is you're in the driver's seat as a survivor. You get to control the conversation and access Linda when you want, any time of day. And it's so important to do this because survivors often can't see the symptoms of the health conditions that Dr. Richardson talked about. And they're certainly, in some cases, afraid to talk about them because they're just wanting to rebuild and get on with their life.
But Dr. Richardson, what about those saying you need the human touch? This should not replace the one-on-one contact that people do need, especially when you are going through something as traumatic as a cancer diagnosis.
Well, that's what I usually say quite a bit, is the human touch is very important. But one of the things that we've learned through the research on the simulated virtual human experience is that people feel like they're talking to a real person. When we were developing her, and even now I call her by her first name, Linda, when I'm talking about her in conversation. So it really is a human touch. And what this tool really does, it provides information for people who've had cancer that they can now take to their providers and ask those questions and feel empowered to ask questions about their health, how to change their health, how to be healthier. So that really, but you're absolutely correct. You would think that it would be sort of a false experience, right, but a lot of people interact much better with Linda than they do with real people.
Let's talk about the lifestyle changes that Linda urges the patients then to sort of adopt. How important is that component to wellness?
Well, they're all important to wellness for all of us, but for cancer survivors, it's even more important because those risk factors that cause the first cancer can actually cause the cancer to come back. If you smoke and you continue to smoke, the recurrence rate is higher, as well as getting new cancers. And so for all of the risk factors, it really is important to try to live a better life, to live healthier, which is something we all should be trying to do.
And Rebecca, for those who are struggling with this, don't know where to go, what would you say to them? What helped you the most while you're going through your battle?
Yeah, so in the weeks and months post-treatment, I battled clinical depression and anxiety, and I could not see those symptoms in myself. And what the message that we want to send to survivors this morning is, help is out there. You don't have to suffer in silence. These things are nothing to be ashamed of. They're very common for people who are, moving into survivorship, and as survivors, there's so much to think about from a health perspective. So having this resource, having, when sometimes survivors are afraid to reach out to their community, even to their partners and friends, and Linda is there. Linda is your virtual friend, and available any time of day for those survivors who are up at night with insomnia. Linda's available.
And to that end, last question, Dr. Richardson, where can people go to get this information to find out more about Linda?
They can find all our resources at cdc.gov/cancer/survivors.
Lisa and Rebecca, thank you so much for your time this morning. I think you've introduced our audience to a valuable tool that I'm sure will help many people. Thank you so much for your time this morning.
Thank you.
Thank you.
All right, back up to you guys.